I'm here with Brian Reagan from InMode, and Brian is going to tell me all about the company. So tell me, what is InMode?
InMode is the most exciting new thing in cosmetic medicine and surgery.
What makes it so exciting?
One of the major challenges as we age is skin laxity. Things get loose. And
yes, they do.
Until recently with InMode, the only really effective treatment is surgery, excisional therapy, surgery. Previous to InMode, most of the technology gave you very small improvements. They were costly and patients were often left underimpressed. InMode is new technology that gives us real results with less downtime, and it's phenomenal. And it's going to change the landscape.
So when you say less downtime, how much time are we talking, and what results are we going to see?
So probably 95% of people who are 50 or older have laxity of their lower face and neck.
You always hear women complaining about that.
Well, they look down at their phones and they see all this loose stuff and they hate it.
Yeah.
Also, you have a lot of younger women that are starting to see it, but they're not good patients for anything more aggressive.
But younger girls are starting to do things way earlier.
Well, that's another group. But it's for the young patients, not the patients who are about 40, who are starting to see laxity and they're not good candidates for something more aggressive.
Right.
Or the patient that has real laxity, but for whatever reason, they don't want traditional surgery. This is a huge group of patients out there. And InMode now has provided us with technology, radiofrequency assisted lipoplasty.
Oh, wow.
And this allows us to effectively, predictably, safely remove fat and tighten the skin. And this can be used on the face, it can be used on the abdomen, it can be used in many areas of the body that are traditional troubled areas. So it's the first time that we've had a tool that bridges between excisional therapy, like a tummy tuck or a facelift or an arm lift, and previous technology that didn't do much.
So how painful is it? What's the level?
It's not painful at all. This is an office-based procedure.
Not painful at all? You don't feel anything?
So I was fortunate enough to work with some of the Housewives of Orange County, and you saw it on a recent show. And we do this procedure with them awake. You can do it with some sedation, but you don't need to. It's as easy as coming in, taking some medication, and doing the procedure, and it takes about 2 hours.
It takes 2 hours.
The downtime is about 3 days.
Wow. And what do you look like when you walk out? What's your face looking like?
You can look a little bit swollen, and we tell patients there's not a tremendous amount of pain. You go
Just
home.
Swollen, no redness?
InMode has two types of approaches. They have FaceTite BodyTite is a probe. It's bipolar radiofrequency. So there's a probe that goes under the skin and one that goes on top of the skin. And through this area, you're able to focus the radiofrequency. The radiofrequency tightens the skin and delivers heat to the area. They also have microneedling bipolar radiofrequency. So that's an external device that treats texture. So that treats less laxity and more crepiness. So combined, we call it EmbraceRF, and combined, you're getting real results. See, patients come to me, and they don't know what technology they want. They know what bothers them. And it's up to me as the provider to say, this is right for you.
This is going to work.
Yes.
This will give you the look you desire.
And I hate patients that aren't happy, and I hate results that fall short of expectations. And I know that surgery is always going to meet those expectations, but very few patients end up getting surgery for a lot of reasons. Fear, downtime. Money's not really one of the reasons. Most people think if it's something they really want and it's going to work, they're going to save for it. They value that. So InMode, with its bipolar radiofrequency, gives me a tool that allows me to deliver predictable, good results with very little downtime, no anesthesia. So it's going to change the landscape.
So win-win for us all.
Absolutely.
So when you, obviously with microneedling, you're going into the skin. When you said the InMode goes underneath the skin, what did you mean by underneath the skin?
So you need some access points. So it's a 16 gauge needle. It's a very small needle. It's a little puncture wound. And there's a very small probe that goes under the skin and one that goes on top of the skin. And you're able to concentrate the energy. So it's a little bit, it's like liposuction with a very small probe.
And will you be left with incision marks and no scarring?
They heal up,
immediately?
absolutely. Yeah, exciting.
Sounds too
Right?
good to be true.
It's true.
So did you get any awards over the weekend?
InMode has been awarded.
Congratulations.
We're very excited. Yeah.
So to receive that award and be here at Aesthetic Everything, what does that mean to you?
Well, listen, I'm very proud of the company, and I'm also thankful that they have provided this technology for me as a clinician so that I can meet my patient's needs, right? Not every patient wants surgery, but every patient has complaints. And before, it was either something that's going to work or something that most likely was not going to work. And they have now given us something that bridges that in a safe, predictable way.
How long has this been on the market?
I've been doing the InMode technology, the bipolar radio frequency, for about 4 years, and I was one of the early adapters. And it's an incredibly fast-growing company.
Any talks over the weekend? Have you?
I did. I presented yesterday, and it was very well received.
How did that go? What did people learn from your talk?
Well, I think they learned that this innovative technology is effective, it's safe. You know, in our industry, there's a lot of fluff. And sometimes it can be challenging for the consumer and the surgeon and the physician to decipher what is real and what is fluff.
Yeah.
And hopefully what they learned is these are real results, sometimes approaching surgical results. InMode with its bipolar radio frequency, EmbraceRF is the tagline for all of the technology that gives us tightening of the skin and improves crepiness. I think it's a wonderful technology. I'm happy to be using it. My patients are happy I'm using it.
Have you used it on yourself?
Not yet. Soon.
Gotta try it out.
Everybody.
Right?
Hey, listen, this is a great approach for men.
Yeah.
A lot of guys don't want facelifts. They just don't want to be the guy who got a facelift, right?
Yeah.
But InMode works particularly well when there's a little extra fat underneath the skin, and a lot of guys have that. So it's a fast-growing segment of my patients.
Wow.
Pretty
That's
impressive.
incredible.
All right.
Dr. Reagan, thank you so much.
Terry, thank you.
So nice to meet you.
Hi, Dr. Brian Reagan. Come see me on Instagram at DRB Reagan Plastic Surgery. You can visit us at CosmetiCare.com. See you soon.